So our today's topic is about the different eye movements, and the first one is called the duction. Second one is called version, Version, and the third one is called the vergence. So in this video, in this lecture, we will discuss about these three eye movements. As you can see, the first one is called the duction, right? So if you want to study about the duction, if you want to observe the duction in patient's eye, keep it in your mind that the patient's one eye, the one eye of the patient is occluded, right? The duction is all about the monocular eye movements. Again, if you want to study, if you want to examine the duction eye movements, remember, always keep it in mind that one eye should be occluded, right? Every possible eye movement, every possible monocular eye movement is called the duction. Like if I occlude my one eye and I can rotate my eye in the lateral direction away from the nose, which is called abduction. I can move my eye in the medial direction, like which is called the adduction. I can elevate my eye, elevation. I can move my eye in downward direction, which is called depression, or I can extort my eye. I can intort my eye, like extorsion and intorsion. The adduction, right? Adduction means you are moving your one eye, monocular eye, in medial direction or towards the nose. That is called adduction. The second one is called abduction. Abduction means your one eye is moving away from the nose towards the lateral side. And the third one is called elevation. You are moving your one eye in upward direction. And the fourth one is called the depression. Depression means in downward gaze. Fifth one is called intorsion. Intorsion means you are actually rotating your eye towards the nose, right? The rotational movement, right? That is called intorsion. And the last one, the sixth one, is called extorsion. Extorsion means you are moving, actually you are rotating your eyeball away from the nose, right? That is called extorsion. So all of these movements are about the duction. But remember again, the duction is all about monocular eye movement, the movement in the single eye, the movement in one eye, right? So adduction, abduction, elevation, depression, intorsion, and extorsion. All of these movements are called the ductions. And now we will discuss about the version. So if you want to define the version, you have to keep it in mind the three different words. The first one is binocular. Remember, version is all about binocular eye movements, right? In contrast, the duction was all about monocular eye movement, right? But version is binocular, right? We will examine both eyes, right? So its first one is binocular. The eye movement should be binocular. Second one is simultaneous. Simultaneous mean both of your eye will move at the same time. That is simultaneous, right? So first one is binocular. Your both eyes will move, right? Simultaneous mean your both eyes will move at the same time, right? And the third one is conjugate, which is important. Conjugate. So if movement is in binocular in both eyes, and both eyes are moving at the same time, simultaneous, and conjugate mean both the movement of the both eyes are in the same direction, right? So binocular mean both eyes, simultaneous mean at the same time, conjugate mean same direction, right? So this is how we can define version. So if both of your eyes are moving, but moving in the same time, at the same time, and moving in the same direction, so this eye movement is called the version. And now we will discuss about different examples of the version. So we have put a very compulsive, you can say, condition that version is binocular, simultaneous, and conjugate eye movements. Both eyes are moving, both eyes are moving at the same time, and both eyes are moving at the same time and in the same direction. So this type of movement is called the version. So now we will discuss about the different examples. Suppose these are two eyes, eye number one, and eye number two. If both of my eyes are moving upward at the same time and in the same direction, right? So this is called elevation. So this is binocular, conjugate, and simultaneous movement. So this is version. Both eyes are moving in the upward direction, elevation, right? And now again, this is example number one. Example number two, both eyes are moving in the downward direction, right? Further, I will discuss about the different muscles which are involved in the version, right? And if the both eyes are moving downward direction at the same time, right, and in the same direction, so this is also depression, is also binocular depression actually is also version, right? And now again, this is example number two, and now this is example number three. Suppose your both eyes are moving upward and in the right direction like this, right? So this is the both eyes are moving in the right side but in upward direction, in right upward direction, right? So this eye movement is called version. But which kind of version? It would be dextro version, right? Dextro mean right, right? I can write it for you. Dextro mean right, and levo, leavo, levo mean left. So dextro mean right and levo mean left. So if your both eyes are moving upward but in right direction, so it would be dextro elevation. This is example number three. And now example number four, if your both eyes are moving in upward direction but in the left direction, in the left side, so that would be levo elevation. Levo mean left, elevation mean upward, right? So this is also a version, right? Levo elevation. Now again, if your both eyes are moving in downward direction but at the right side, right? So this is also right side mean dextro and downward mean depression. So it would be dextro depression, right? And again, if your both eyes are moving in the downward direction but in the left side, so this is also called levo depression. So all of these eye movements are called, you can see all of these eye movements are binocular, all of these eye movements are simultaneous, and all of these eye movements are binocular, simultaneous, and conjugate, moving in the same direction. We will discuss about, right, about the different version eye movements. Like you can see, these are both eyes, these are two eyes, which means binocular. And if both eyes are looking upward, as you can see, these eyes are looking upward direction, right? So this is elevation, right? So again, these two eyes, if these two eyes are moving downward, as you can see, the eyes are moving downward, looking downward. So this is depression. So this is also a version movement. Now again, these are two eyes, and these two eyes are looking at upward and right direction. Suppose this is right direction, right? So both eyes are looking upward but in the right direction. So that would be dextro elevation, right? Next, again two eyes, and now these two eyes are looking upward but in the left direction. So there is elevation but in the left side. So that would be levo elevation. That is also version. Now again, these two eyes again, but these two eyes are looking in downward direction, but at the right side. Here, depression and right side. So that would be dextro depression, right? So that is also binocular, simultaneous, and conjugate. So that is version. And now again, two eyes, binocular, but right now these are looking at depression, but at left side. So that would be left mean levo, and eyes are moving downward, so that would be depression. So it would be levo mean left and depression because eyes are looking at the downward direction. So that would be levo depression. And other examples like again these are two eyes, right? And if the eyes are looking at the left side, both eyes are looking at the left side, so that would be levo version, right? So that is levo version. Now the last one, suppose both eyes are looking at the right direction, right? Both eyes are looking at the right direction, so right mean dextro version. So these are some examples of the version. And now the last eye movement or vergence, right? So if you want to define the vergence, again there are three compulsive conditions. Number one, the same as the version, like binocular. Second one is you can say simultaneous, and the last one is disjugate, right? So the difference between the version and vergence is of the version is about conjugate eye movement and the vergence is about the disjugate movement, right? So disjugate mean we have discussed about the binocular, both eyes. Binocular mean both eyes. Simultaneous mean both eyes are moving at the same time. But in vergence there is disjugate, both eyes are moving in opposite direction. So disjugate mean opposite direction. So if one eye is moving at the right side, the other eye will move in the left side, so direction is opposite. So these kinds of, you can say, eye movements are called the vergence. So there are two types of vergence, you know very well about it, that convergence, if both eyes are moving in the opposite direction, if both eyes are moving towards the nose, so it means the right eye is moving in the left side and left eye is moving in the right side. So if both eyes are moving in opposite direction, right, both eyes are there, so this is binocular. Both eyes are moving at the same time, so that is simultaneous. But the difference is both eyes are moving in opposite direction. One is moving in the right side and other is moving in the left side, so direction is different. So if the direction is different and both eyes are moving at the same time, those kind of specific and particular eye movements are called the vergence. So types of vergence, type number one is called the convergence and type number two is called the divergence. If both eyes are moving towards the nose, that is called convergence, and if both eyes are moving away from the nose, that is called divergence, right? So these are called convergence and divergence, which is collectively called the vergence eye movements. Like suppose these are two eyes, and if both eyes are moving, this is nose, both eyes are moving towards the nose, so this eye is moving, so this eye is moving at this direction and this eye is moving at this direction, so movement of the eyes is opposite, right? So this is called the vergence, which is called specifically convergence, right? And now the divergence mean both eyes are moving away from the nose like this, but divergence is always limited, right? So this is divergence, right? This is nose. So both eyes are moving away from the nose. This is called divergence, right? So this eye is moving toward this direction and this eye is moving toward this direction. So direction is opposite. So these type of eye movements are called, these type of eye movements like binocular, simultaneous and disjugate movements are called the vergence. So in this lecture we can extend the convergence. If both eyes are moving towards the nose, this type of eye movement is called the convergence, right? So convergence has 4 different types. Like the first one is called the tonic convergence. Second one is called proximal convergence, right? Third one is called accommodative, right? First one is tonic, proximal, accommodative, and fourth one is the fusional. And now we will discuss about these 4 types of convergence briefly. So the first one is called the tonic convergence. Tonic, the tone of the muscles. We have to conclude that which type of muscles are there which are involved in convergence, right? So you know very well about those muscles. Those are the recti muscles, and the name of the muscles are medial recti muscles. So the convergence which is actually induced with the help of the tone of the medial recti muscles. So the convergence which is induced by the tone of the medial recti muscles is called the tonic convergence, right? Again, the type of convergence which is actually induced with the help of the tone of the medial recti muscle is called the tonic convergence. Now, the second one is called the proximal convergence. Proximal convergence is actually that type of convergence. Suppose if I'm looking at you, but I have some markers in my hand, I'm looking at you, my target is you people, right? But still I can see these markers. I know that this is blue marker and this is black marker. I'm looking at you, but still I can see these markers. So that is actually a psychological awareness of this near object. So that minute convergence which is actually inducing with the help of these near object psychologically, that is called the proximal convergence. Hope this is clear. So it is all about the psychological awareness of this near object. That minute least amount of convergence is called the proximal convergence. Hope this is clear. And the next one is called the accommodative convergence. You know very well about the ACA ratio, right? ACA ratio. ACA ratio mean, you know very well, you need to learn about the relationship of accommodation and convergence, right? So you know very well that what is accommodation. Accommodation is actually the increase in the plus power of the crystalline lens is accommodation, right? So accommodation is actually the increase in the plus power of the eye and specifically of the crystalline lens. So that is called accommodation. If your lens is increasing its curvature, if your lens is increasing its thickness, if your lens is increasing its power, that is called accommodation, right? But keep it in mind that accommodation and convergence are simultaneous processes, simultaneous phenomena, right? If there is accommodation, there should be convergence. There would be, I must say, there would be convergence. So accommodation and convergence are simultaneous processes, right? So these are actually the best friends. You can say accommodation and convergence are best friends. If accommodation is picking up one marker, right, then convergence will pick up 3 markers. This is the ratio, right? If one friend is picking one marker, the other friend will pick up the 3 markers. So this is the ratio, right? So if there is one diopter of accommodation, there would be 3 prism diopter of convergence, right? One diopter of accommodation. If your lens is exerting accommodation of one diopter, convergence would be of 3 prism diopter, right? So this is the ratio. So that type of specific type of convergence which is actually induced with the help of accommodation, right? That type of convergence is called the accommodative convergence. Accommodation will be there, then there would be convergence. So that type of convergence which is actually induced with the help of the accommodation is called accommodative convergence, right? And the last one is called the fusional. If you want to learn about the concept of the fusion or fusional convergence, so what is actually fusion? Fusion, let me explain. If I occlude my one eye, I still can see you people. Or if I occlude my this eye, I can still see you people, right? So it means there are two eyes. So when there are two eyes, there are two retina. Retina number one in my right eye, retina number two in my left eye. So it means there are two different images, but still I can see you as a single personality, as a single object, right? So how this is possible? This is possible with the help of the fusion. These two images on the two retinae are superimposing, right? So when two objects are superimposing, I will look at a single object. So that is called fusion. So that specific type of convergence which induced with the help of the fusion is called the fusional convergence. I hope all the concepts regarding the duction, version and vergence and type of convergence are clear. We'll see you in the next video.